it really deserves the award. Okay, it's my pleasure to bring the next presenter up here. He's a young man who, even now, who trained in my program at County, now some 20 years, maybe 30, but he's carved out a reputation as a premier spokesperson and activist in the field of environmental and occupational health. I asked Dan Hryhorczuk to come up, please.
Very honored to introduce the next recipient of the Health and Medicine Policy Research Group Award in Medicine, Dr. Bob Cohen. When Bob was a medical student back at Northwestern, he spent the last 6 months of his clinical rotations at Cook County Hospital. Bob continued his work at County as an intern, as a resident in medicine, then he did a fellowship in pulmonary medicine, and throughout all these years, he not only survived many changes at Cook County, but rose through the ranks to now be the chief of the Division of Pulmonary Medicine and Critical Care at Cook County, and also the chair of Pulmonary Medicine and Critical Care for the entire Cook County health system. He's going to be leading the county's efforts to address the current H1N1 pandemic. But that's not the main reason that Bob was nominated for this award. For the past 20 or more years, Bob has worked tirelessly to address the health and safety needs of our nation's coal miners. Bob has been attending in the Black Lung Clinic at Cook County for 20 years or more, but not only that, he leads all of the national Black Lung clinics around the country. Bob also works as faculty at Rush Medical School and on the faculty of the University of Illinois School of Public Health, and he's focusing on addressing the health and safety needs of miners, not just through diagnosing and treating sick miners, but also through preventing illnesses and injuries from occurring in the first place. He's a consultant to OSHA, consultant to NIOSH, and is working on engineering controls to help suppress dust levels in mines. And Bob's not only worked on these issues here in the United States, but also even got him to go to Ukraine to help address the health and safety needs of miners in Ukraine. So I think Bob embodies everything that's right about public medicine and is very deserving of this award.
Thank you very much, Dan, and everyone for this very, very great honor. I actually just first came to the county when I was a baby doc, and it was just very short. I just missed Quentin by a few months, but his leadership, his aura, his whole majesty and ideas have reigned ever since, and really influenced generations of us at county. So I'm what they call a county lifer. So I came there when I was 23 years old from Northwestern, and I won't mention my age now, but it's older. And I've cared for people at the old county hospital, the old Fantas Clinic, the new Strozier Hospital, and now I have the opportunity to care for people at Providence and Oak Forest hospitals and throughout the county system, and it's been an honor. And it really is an honor to work in government-sponsored, government-paid healthcare for people who need healthcare, and the only requirement is that you come there and you actually have to be in the county of Cook, but we also take people from O'Hare Airport who just landed and people from all over. Anyone who can make it to our doors we take care of, which is a phenomenal honor, and it's just something that no one else in healthcare, unless you work in a safety net hospital, can say that or can do that, and that's really what we should all be doing, and we should all have that opportunity. And unfortunately, only those of us that work at hospitals like county can do that, and even though we're challenged by lack of resources and some huge logistical issues, we struggle with it, but it's a great pleasure to be able to take care of people who need to be taken care of, to order what they need and provide them the care they need. And then I had the opportunity to work in the Black Lung program and taking care of coal miners, not only that came to us from Appalachia here, but also throughout the country and help them. And that was also a great honor to work with these folks, these hard-working people. And it combined all my loves, which is a love of medicine, a love of pulmonary medicine, loving workers and people who spend their whole lives dangerously trying to do things, provide for their families and provide for us, and then often suffering because of the work that they do. And then it also helped me I'm a little bit of a scrappy person, those that know me, so I got the opportunity to fight coal companies in order to get benefits for these people, and I really enjoyed that. getting into a good fight with a coal company lawyer is it's always a great day for me when I come home after doing that. The problem with that is that we can only fight for people to get benefits, and when they get black lung benefits, they get full lifetime medical health care paid by the government, but just for their lung disease. So we can't take care of their back and their hearing loss and all the other problems. And so that's, again, it's a huge honor, but like Cook County, we're limited by people who live here. For the federal black lung program, it's national. We have to fight very, very hard, and only 7% of those who apply get benefits. We can only take care, their lungs are the only things that are paid for. So it's just, you know, the work that the Health and Medicine Policy Research Group does to fight for health care for the whole body, for not just the lungs, and to fight for health care for everybody, regardless of where they reside, I think is an enormous inspiration. I'm very honored to receive this from this group. Thank you very much.